If a relative says, "So are you telling me my sister is faking it?" How would you respond in your exam?
Functional Neurological Disorder.
Hi everyone, I'm Dr. Clarke, MRC Psych, and welcome back to Pass the CASC. Today we're tackling a station that many candidates find conceptually tricky, explaining functional neurological disorder, specifically functional seizures, to a worried and slightly defensive family member. This is a brilliant station to score highly in if you stay calm, validate strongly, and explain the diagnosis in simple, confident language. In this video, I'll show you exactly how to explain the diagnosis clearly, address stigma and the "is it psychological" fear, align with neurology colleagues, outline management and prognosis, and demonstrate biopsychosocial thinking without sounding vague or dismissive. Let's break it down.
You are working in a neuropsychiatry clinic. Aisha Rahman, 29, has had 9 months of collapse episodes with shaking. Investigations were all normal. Neurology have diagnosed functional neurological disorder. Her sister Nadia has come to the clinic today and is worried the diagnosis means Aisha is imagining it or doing it for attention. Your task is to explain the diagnosis clearly and sensitively, and address concerns about the nature and cause of symptoms. In FND stations, examiners are looking for clear explanation of functional versus structural disease, explicit statement that symptoms are real and involuntary, confident alignment with neurology colleagues, biopsychosocial formulation, and realistic optimism. Candidates must avoid saying nothing is wrong, over-psychologizing, using outdated terms like hysterical or pseudo-seizures, and sounding uncertain about the diagnosis.
Hello Nadia, my name is Dr. Clarke and I'm one of the doctors in the neuropsychiatry team. I understand Aisha has recently been given a diagnosis of functional seizures and that this has raised some understandable concerns. What I'd like to do today is explain what this diagnosis actually means, why the neurology team are confident about it, and then answer any questions you have. Does that sound okay? Before I explain anything further, could you tell me what worries you most about this diagnosis? It sounds like you're worried this means the doctors think she's pretending. And it doesn't make sense that something so dramatic can happen when all of the tests are normal. You're also concerned that something serious has been missed. I completely understand why this feels confusing, especially when you've seen how exhausting and frightening these episodes are.
This validation is crucial as it helps prevent the relative from escalating, gets them on your side, and makes them more receptive to the explanation that follows.
Would it help if I explain what we mean by functional neurological disorder? There are broadly 2 types of seizures. One type is caused by epilepsy, where there is abnormal electrical activity in the brain. That's what shows up on tests like EEGs. The second type looks very similar physically, but happens without those abnormal electrical discharges in the brain. That's what Aisha is experiencing. Her recent video EEG captured one of her typical episodes, and it showed that her brain's electrical activity remained normal during the attack. That's how the neurology team can confidently say that these seizures are not caused by epilepsy. But the important thing to say very clearly is this: these episodes are real. They are not imagined, they are not deliberate, and Aisha is not choosing them. All of her scans show that the brain structure, or the hardware, is completely healthy, but sometimes the way that the brain functions, or the software, can still temporarily misfire. Functional neurological disorder means there is a problem with the way the brain is functioning, but not damage to the brain itself. That's why the tests are normal, but the symptoms are still very real. This doesn't mean that Aisha is making it up. And it certainly doesn't mean it's her fault. But what we do know is that the brain and body are deeply connected. For example, it's well known that stress can trigger headaches, anxiety can cause palpitations, and shock can cause someone to faint. In some people, especially after prolonged stress or emotional strain, the brain can switch into a kind of overload state, and that can trigger physical symptoms like shaking or collapse, completely outside of conscious control. Just to be clear, these episodes are all involuntary. Sometimes these symptoms happen after a period of high stress. Has the past year been particularly difficult for her? It sounds like she's been carrying a huge amount, perhaps without really having the space to process it. We often see functional symptoms in people who are coping bravely on the outside, but are actually under enormous internal strain. Anti-epileptic medication treats electrical seizures. Because Aisha's seizures are not caused by abnormal electrical activity, those medications won't help these events. Also, they could give her unwanted side effects, so I wouldn't recommend taking them for Aisha. Treatment for this is very much collaborative and holistic, meaning we look at the whole picture, not just the seizure episodes themselves. We would begin with a full assessment to properly understand her stresses, her mood, and her coping patterns. The first step would be to review Aisha's medications. If she's on anti-epileptic medication that's not needed, we would gradually and safely reduce that in discussion with neurology. We'd also assess whether anxiety or depression are present, because if they are, treating those can significantly reduce the frequency of attacks. Psychologically, education is actually the foundation of treatment. Simply understanding what functional seizures are and knowing they are real, common, and treatable can in itself reduce how often they happen. The main proven treatment is cognitive behavioural therapy, or CBT, specifically adapted for functional seizures. This helps people recognise stresses, understand body signals earlier, and develop strategies to prevent or reduce episodes. Other therapies that explore stress, coping patterns, and emotional processing can also be helpful, especially if someone has been carrying significant life stress, as Aisha has. On a social level, we also think about rebuilding confidence and routine. We'd usually recommend a gradual return to work and activity, not rushing back too quickly, but also not avoiding life altogether. Occupational support can be really helpful in planning that safely. And importantly, we would look at specific stressors, such as financial pressures, because reducing ongoing stress can make a real difference to recovery. Sometimes symptoms begin to reduce simply once people understand what's happening. Many patients improve significantly with appropriate treatment. Outcomes tend to be better when the diagnosis is explained clearly, the person understands and accepts it, and treatment begins early. I can't promise the episodes will disappear overnight, but many people experience a meaningful reduction in frequency and severity. With support and gradual reintegration, many people do return to work. The aim isn't to label her as unwell indefinitely, it's to retrain the brain's response and restore confidence and function step by step. I've shared a lot of information with you today. How is all of this sitting? I can see how much you care about your sister. Just to summarise, Aisha's symptoms are genuine and involuntary, but her brain structure and electrical activity are normal, which rules out epilepsy. This is a recognised condition called Functional Neurological Disorder. It reflects a disruption in how the brain is functioning, not damage to it. It's treatable, and many people improve significantly with the right support. From here, we will work closely both with neurology and psychological services to help her recover as quickly and as fully as possible. I appreciate how concerned you've been, and that's completely understandable. If new questions arise, or if you or your sister would like to attend a future appointment, we would very much welcome that. Before we finish today, is there anything we haven't covered that you were hoping to ask?
This approach, validates distress clearly, explicitly states symptoms are real, aligns with neurology, explains functional versus epileptic seizures clearly, uses accessible analogies, outlines biopsychosocial management, and provides realistic hope.
This station is not about neurological detail, it's about clarity, it's about confidence, and it's about compassion. If you can calmly explain the difference between epileptic and functional seizures, explicitly say the symptoms are real and involuntary, and outline a clear treatment plan, you will score very highly in this station. Try explaining this condition out loud now. Record yourself. Notice whether you clearly say, "These symptoms are real and not deliberate." That one sentence alone can transform your mark. If this video helped you, like and subscribe, and comment which topic you'd like me to cover next. And remember, slow down, chunk and check your explanations, and always validate first. That's what turns a borderline pass into an excellent pass.
Thanks for watching Pass the CASC. If you found this video helpful, subscribe to Dr. V.T. Clarke for more exam-focused psychiatry teaching. And if you're looking for a complete CASC revision toolkit, download Cascade, the app, now.